One of the more common questions is which should I go with, a saline or a gel implant? And I actually have a video specifically dedicated to that question, so you might want to look at that. But in very general terms, the saline implant versus the gel implant, the gel is slightly lighter. It's about 5% lighter for the same amount of volume. It has a much lower risk for rippling and wrinkling. You can see when this one is up, it's got a little ripple or a wrinkle on it. This one can also get it, but it's much less likely to occur. This one has a much more natural feel to it than the salines do. It has a lower failure rate and it has a lower infection rate. Now the disadvantage of using a gel is that I might need a little bit longer incision. The saline implant, I can roll up like a cigar, put it through a very small incision, and then inflate the implant. This one is from the factory, just like what you see here. So I can't roll it up, so I might need a little bit longer incision to get it in. The other disadvantage to it is that this gel implant is slightly more expensive than the saline. And also there is a FDA recommendation that at 3 years and then every 2 years thereafter post-op that you have an MRI to check on the status of the shell. Now there's really not any good data supporting that recommendation that I'm aware of, but nevertheless the FDA has made that recommendation and I want you to be aware of that.